Do you wonder if you're the best version of yourself? This is the question we seek to answer in this podcast. We reveal information that helps you recover your health and become resilient. Modern life makes us fragile. Our diet, lifestyle, and environment set us up for failure. We do not accept this. We seek optimization. We strive to become dynamic. Hey, what's going on? Dr. Chris here. New Year's is approaching. I figured I'd squeeze in one more podcast before we turn over to season 6. And I want to talk about something I'm thankful for. And oddly enough, I chose pain. Now, before I get into this topic, I want to make sure to say this first. I don't want to minimize anybody's pain experience. Everybody deals with pain at some point in their life. I've been through it. It can be brutal. There's nothing fun about it. So I want to first start off by saying I am not trying to say pain is not real or it's in your head. That's definitely not what I'm talking about. There are definitely times where pain becomes chronic and very hard to manage. And that's not really what I'm going to be talking about today. I'm talking about your sort of typical musculoskeletal pain. Unfortunately, there's still a lot of healthcare practitioners that do say things to patients like, this pain is just psychosomatic or it's in your head. And although there may be a little bit of technical truth to that, which we'll get into, that makes people feel unheard, and it's just not a good approach. And there is a realm of science called pain science now, and a lot of therapists will kind of just try to talk people out of pain, and I also think that's the wrong approach. I definitely think pain science is important, and I definitely talk about it with my patients, but it is not the sole therapeutic way, or at least my way. So why are we thankful, or why am I thankful for pain? Well, pain is information, and without it, we'd probably be dead. Imagine if you had no pain receptors at all, and you just put your hand on a hot stove and just kept it there. That'd be pretty damaging. You would get no information back telling you, hey, move your hand. Or if you stepped on a really sharp piece of glass and your brain didn't tell you, hey, move away from that painful thing, and you just kind of bled out. It's a locator, right? So it tells your body where the issue is. It also tells you what is provoking it as well if you pay attention to it. It's pretty amazing if you think about it. It's like our own diagnostic tool. Like, when you can plug that thing into your car, it tells you where the issue is. We kind of have the same thing. So what is pain exactly? I like to think of it as a fire alarm or a smoke alarm. If you have a son who is 15 years old, who likes to cook bacon in the kitchen and smoke out the house, you want that fire alarm to go off to let you know that there's a problem in the kitchen. What's different about pain, the way our brain perceives it, really our nervous system, is that it's like a smart smoke alarm. So picture my son goes into the kitchen often to cook bacon, and every time he approaches the kitchen, it becomes alarmed. It becomes more vigilant that he's approaching. And then it becomes sensitive. Maybe it goes off before he even turns on the stove. And then next thing you know, it's become hypersensitive, and then you light a candle in the house, and then the alarm goes off. And obviously, that's an erroneous signal at that point and not very helpful. That's kind of the way I think of chronic pain, is when it's like a repeat offender. You keep doing the same thing over and over, and the system gets hypersensitive. There's a lot of variables to that, too. Your lifestyle, your diet, all these things can play a part in creating hypersensitivity. If you're sleeping really poorly and you have a lot of stress in your life, and you go out and you do the same motion that bothers whatever joint, it can make the whole system hypersensitive. Also, the way we think about pain and how we perceive it can impact it. So if we fear pain, it can augment the experience. And that's usually where, I will talk to my patients about what pain is and how to reframe the way they think about it so that they don't tip into a chronic pain scenario or create a hypersensitivity scenario. That can definitely be a challenge to fix or work with. So what we do in that scenario is retrain the brain to do a certain movement and not produce a pain signal. So you usually kind of go under where the pain threshold is. So because the body will learn, the brain and the nervous system will learn. This goes way beyond consciousness. And by the way, the pain areas of the brain, so the pain signal is produced inside the brain in what's called the pain matrix. So that this is a network, an interconnected network of regions that include the anterior cingulate cortex, the thalamus, the insular cortex, the primary, secondary somatosensory cortexes, and even the prefrontal cortex can play a role in this as well. That's all besides the point. The nervous system is meant to protect us through evolution. It learns. It says, okay, whenever I do this, it creates pain. Get away from that thing, whatever it is. So your nervous system will sort of map movements that are painful in order to protect you. In times where this hypersensitivity occurs, we want to remove that because it's not a helpful stimulus. So what we can do is say, you learn that going up and down stairs hurts. Well, if you keep doing it and ignore your body signals and don't sort of fix the underlying issue, you develop this hypersensitivity. So what we would then do is start to load the knee in non-painful ways. So that might look like a small step up if that doesn't produce pain, and progress you back up to doing a regular staircase without pain. Or if it's bad enough, you might have to do non-load bearing exercises first to extend the knee and bend the knee without pain, just to kind of allow the system to cool down and then build you back up. But I'm getting off topic, so let me kind of recenter myself. So the reason I thought of this podcast is one of my buddies hit me up, shot me a message, said, hey, my elbow's bothering, what should I do? It's always fun for a therapist to get that because there's a lot of complexity to that. So I asked him a couple simple questions, and I told him just to pay attention to what motions bother him. Because when you're trying to solve a pain problem, half of it is knowing what to do. The other half of it is knowing what not to do. So you have to pay attention to the motions that are provoking the thing and lay off those motions temporarily until we can figure it out and fix the underlying issue. So anyway, that's what I told my buddy. I said, because I asked him, what motions bother you? He wasn't quite sure. So I said, okay, reframe how you think about pain. Pain is your information source. And when you do X, Y, or Z, that's the thing that's provoking it. So don't fear pain, just respect it. The other thing I should bring up too is that, people think when they're in pain, they're injured. I kind of think of it differently. Pain precedes injury, right? So pain usually happens before actual tissue damage occurs, right? So and just the opposite happens. If you have full tissue damage, it might hurt for a split second, and then there's typically no pain. When you have a full muscle tear, you'll feel it in that second, but like a full tear, there's nothing that you're tugging on, so it doesn't really hurt anymore. You might be dealing with some swelling, which can cause some pain, or if you have, say you get wounded, like for example, I was in high school, I was playing street hockey, and I slipped on some wet leaves, and I fell on a piece of glass, opened my knee up, I didn't feel a thing. And it wasn't until people pointed at my knee that I realized, I'm bleeding, and I could see the fat pad hanging on my knee. I didn't feel a thing. Now, the surrounding tissue that was at risk for infection, if I touched it, that was painful. But that's because that's information saying, hey, don't touch that, get that clean. And, whenever I talk to someone who's had some major trauma, I will usually ask them, did it hurt? It sounds like a silly question. I can't tell you how many times people say, honestly, I didn't feel a thing. I've seen people completely bust their tibia while doing box jumps and completely fracture it, and they didn't even feel it. Because my theory is, at that point, pain is no longer a useful signal. So it's another good thing to keep in mind, that it's a good sign. If you're having pain, it could be a good sign that tissue damage hasn't occurred yet. But it's saying, hey, stop doing this thing before tissue damage does occur. The other point I wanted to make about pain, too, is that it guides therapy and what you should be doing. So let's take the low back, for example. So there's what we call a bias or preference or directional preference. So for some people, bending forward hurts. That's so they have a flexion, extension bias, because we name it after what feels better. Or some people feel worse when leaning back, so then they have a flexion bias. So you train the opposite direction, the non-painful way, until the symptoms go away, and that's your kind of workaround to get people better. Now let's talk about a scenario where maybe you have decreased pain or decreased sensation, and what kind of problems occur with that. So the first example that comes to mind is a diabetic neuropathy. So I'm sure you've heard of someone having ulcers on their feet or diabetic ulcers. That comes from a lack of sensation, because what happens is that as your blood sugar goes out of control, it starts to attack things. It attacks the nerves, the blood supply, and it'll tend to attack the periphery first, because that's where all smaller capillaries are, so they get affected easier. And that cuts off blood to the nerve, and the nerve endings die off, and then you get less input from your feet. So when you're just standing there, and you're standing there for a while, you probably notice that, say you're standing in a place for 1 hour. You're going to tend to fidget and offload one leg, move over to the other, because you're getting these little tiny pain signals in the foot saying, hey, you're putting pressure on this for too long, you're pushing all the blood out of the area locally, which is ischemia, and if you do that for too long, you get death of tissue. So it gives you a signal to say, hey, something's going on there, I don't like it, move off of that, and then you shift to the other side. Again, this is coming from the brain, telling you what to do. So I think it was Perry Nicholson who says, I love this quote, pain is your body's request for change, and that's exactly what's going on here. Now, if you don't have that information, you're going to just stay on that one foot, load it too much, create ischemia, and then you get an ulcer. The skin opens up. So definitely not a good scenario to have decreased sensation. So to sum all this up, don't fear pain. Pain generally precedes injury. Pain is information. It's a diagnostic tool. It can guide you and tell you what to do and what not to do. And when that pain starts to go away, or you lose the sensation of pain, bad things tend to occur. So if you've had a recent incident happen, you're dealing with some pain at the moment, take peace in the fact that you are a healthy human. Everybody goes through pain. It's a normal human experience. And it will usually resolve if you do the right things and listen to your body. A ship in harbor is safe, but that's not what ships are meant to do. What does this mean? It means exposing yourself to difficult situations so you become resilient. If you need help building resilience, check out our flagship program called Physiologic Flexibility. This is a 3-month do-it-yourself program that teaches you how to maximize your homeostatic regulators, such as your pH, blood glucose, O2 and CO2 tolerance, and temperature. We give you specific action items through the program with the goal of becoming anti-fragile. If you want to become the inspiration for your friends and family, this is the program for you.